Anxiety disorders in the workplace are extremely common, and in fact they do estimate that that is more common than depression, and in some situations they say it's very difficult to actually give a prevalence rate for anxiety disorders in the workplace because it is so common. So certainly I think in many, particularly very professional organisations, there are a number of people who do have anxiety disorders. However, we're probably labelling it just differently. We're probably labelling it as stress and worry and a little bit of anxiety, but not necessarily recognising it as an anxiety disorder per se. Anxiety disorders can be caused by a couple of main factors. The first is that it can be something that's really got a genetic underpinning, so that means maybe we've inherited it through our genes. The second is that maybe we have learned different ways to respond through our upbringing and through our socialisation that might predispose us to anxiety. And thirdly, we could be exposed to some difficult situations in the workplace, such as a high workload or working on a difficult project for a period of time, or having a challenging event at work. That could also cause anxiety. So the situation can definitely cause anxiety too. There are several signs and symptoms of anxiety condition. So some may be very subtle and some may be more overt. So some really common ones would be people maybe having a rapid speech, talking faster, more pressured than normal, possibly having a lot of thoughts and being more distracted and more perhaps confused in their thinking. It's very much a fast emotion, so there's often a lot of adrenaline going around, maybe the heart rate up a bit, some heart palpitations, possibly even chest pain because of the increase in adrenaline. So it's very fast and quite different to depression in its presentation. Panic attack is a type of anxiety condition that is often a core feature of many of the anxiety conditions that we see in the workplace. If people have a panic attack, it doesn't necessarily mean that they have an anxiety disorder. Panic attacks can occur randomly. They can maybe be a one-off. Someone might experience a panic attack and then never have another one in their entire life. Or it's probably just a warning sign though that somebody's running at a bit of a high level of stress if it's a one-off. People might have more of an anxiety issue or condition if they have repeated panic attacks and it's over a certain period of time, such as a period of a couple of weeks. There are two main ways to manage a panic attack in the workplace. The first is really to work with somebody on their breathing and just helping them to breathe slowly and deeply. The second is just giving them some positive messages that their symptoms are decreasing, such as I can see that you're breathing more calmly, the anxiety is passing now, you're recovering. And just doing those two simple things can really help someone to recover quite quickly from a panic attack at work. Anxiety disorders are best managed through a good treatment professional, such as usually a clinical psychologist who is able to address some of those anxiety symptoms and really give people very good strategies for managing that condition. And when people do receive best practice treatment for anxiety conditions, they're very recoverable and have much success in doing that. From the workplace perspective, what we recommend is really maintaining people at work in some capacity. We know that people's anxiety can increase significantly if they're away from work and they start to get more worried about some of the things at work that they may be exposed to or may not be a part of. So really maintaining somebody at work is really very good recovery for their anxiety condition.